Hello, my name is Dr. Adam Farber, and I would like to talk to you today about meniscus tears. In order to understand meniscus tears, let us first talk about normal knee anatomy. The knee joint includes the thigh bone, called the femur, the shin bone, known as the tibia, a small bone along the outside of the shin, called the fibula, and the kneecap, known as the patella. In addition, there are four main ligaments of the knee joint. The medial collateral ligament connects the thigh bone to the shin bone on the inside part of the knee. The lateral collateral ligament connects the thigh bone to the fibula on the outside part of the knee. The ACL and PCL crisscross in the center of the knee. Also, between the thigh bone and the shin bone, there are two soft tissue shock absorber cartilage pads known as the meniscus. The meniscus on the inside part of the knee is called the medial meniscus, and the meniscus on the outside part of the knee is called the lateral meniscus. In this diagram, the kneecap has been removed, so it is easier to see the medial and lateral meniscus. These are C-shaped cartilage pads that act as shock absorbers between the thigh bone and the shin bone. Again, the medial meniscus is on the inside part of the knee, and the lateral meniscus is on the outside part of the knee. This is a bird's eye view of the shin bone after the thigh bone has been removed. You can see that the meniscus are shaped like the letter C. The lateral meniscus is more circular than the medial meniscus, but both structures go from the front of the knee, around the corner of the shin bone, to the back of the knee. The image on the right is an arthroscopic photograph taken at the time of surgery showing a normal appearing thigh bone or femur, a normal shin bone or tibia, and the C-shaped meniscus between the two bones. The image on the right in this slide is an arthroscopic photograph taken at the time of surgery showing a meniscus tear with a displaced flap of meniscus tissue within the red circle. This is in contrast to the normal appearing smooth meniscus in the image on the left. Many different types of meniscus tears can occur depending upon the orientation or configuration of the tear. A tear from front to back is known as a vertical tear. A transverse tear occurs perpendicular to the rim of meniscus tissue. A flap tear can occur when a portion of the torn meniscus becomes displaced in a flap-like fashion. Meniscus tears typically result in pain on the inside or outside part of the knee joint. This pain tends to be worse with twisting and pivoting activities. Patients also often complain of additional symptoms such as swelling, locking, catching, and painful popping of the knee. Because the meniscus has very poor blood supply, meniscus tears have little potential to heal on their own. Therefore, for patients with painful meniscus tears, surgery is typically recommended to remove the torn portion of the meniscus. The surgery is performed arthroscopically with two minimally invasive incisions as shown in the figure on the right. The surgery is performed on an outpatient basis, meaning that you do not require an overnight stay in the hospital. The surgery typically takes less than 1 hour to perform. After surgery, most patients are able to put full weight on the leg as tolerated, and crutches are used for comfort only. The one exception is that in the event that a meniscus repair is performed. Less than 10% of all meniscus tears are treated with repair, and the vast majority are treated simply by cleaning out the torn segment of the meniscus. This is a photograph displaying the setup for arthroscopic knee surgery. A small fiber optic camera is placed inside the knee through a small incision on one side, and a pair of tiny scissors is placed into the knee joint through a similar small incision on the other side of the knee. The scissors are then used to remove the torn portion of the meniscus, leaving the remainder of the healthy meniscus intact. The image on the left in this slide is a photograph showing the anticipated incisions prior to arthroscopic knee surgery. The image on the right is a diagram depicting the instruments placed in the knee after the incisions are made. Typically, I only use the two incisions in the front of the knee at the bottom, but not the one above. This slide shows three different types of meniscus tears. The black dotted lines represent the area of the meniscus that would be removed during surgery to treat these different tear patterns. The remaining meniscus would be left alone at the time of surgery. As I stated earlier, approximately 10% of all meniscus tears are repairable. If the meniscus is repairable, sutures are placed across the tear in an effort to get the tear to heal and preserve all of the meniscus tissue. This is most commonly attempted in young patients under the age of 25, especially those with ACL tears in addition to a meniscus tear. The image on the left shows a repairable meniscus tear, and the image on the right shows the meniscus after the repair with sutures has been performed. This slide shows a photograph taken at the time of meniscus repair surgery with sutures in place. If a meniscus repair is performed, patients are typically placed on crutches for 4 to 6 weeks and given a knee brace to protect the repair during the healing process. For further information about meniscus tears, please feel free to contact my office at 480-219-3342 or visit my website at phoenixshoulderandknee.com. Thank you.